Vitamin D deficiency occurs when there is not enough vitamin D in the body. About 1 in 3 kids in the United States are deficient in vitamin D, which is essential to healthy growth and development. This deficiency can lead to rickets, poor bone health, and other problems that you want to prevent in your child's young life. Here's what you need to know about vitamin D deficiency in kids, including causes, symptoms, and treatment options to get your child on the right track again. Importance of vitamin D. Vitamin D is important for kids for many reasons. It helps the body absorb calcium, which is important for strong bones and teeth. Vitamin D also helps prevent rickets, a condition that can cause bowed legs and other problems. A lack of vitamin D can also lead to a higher risk of respiratory infections. Causes of vitamin D deficiency in kids. There are many causes of vitamin D deficiency in children. The most common cause is lack of exposure to sunlight. This can be due to spending too much time indoors, wearing clothing that covers most of the body, or using sunscreen when outdoors. Other causes include having dark skin, certain medical conditions that affect fat absorption, and not getting enough vitamin D in the diet. Children who are deficient in vitamin D may have problems such as rickets and weak bones. They may also be at risk for more serious health problems later in life. Sources of vitamin D. There are 2 main sources of vitamin D for kids: food and sunlight. Vitamin D-rich foods include fatty fish such as salmon, tuna, and mackerel, eggs, and fortified foods such as milk, some yogurts, and orange juice. Sunlight is another source of vitamin D. The body produces vitamin D when the skin is exposed to sunlight. But too much sun exposure can cause skin cancer, so it's important to balance sun exposure with other sources of vitamin D. Impact of vitamin D deficiency on children. Worldwide, infants suffer from vitamin D deficiency, which ranges from 2.7% to 45% in prevalence. If a baby suffers from vitamin D deficiency, he or she could develop low calcium levels, which cause seizures, failure in growth, mood swings, weak muscles, frequently contracting respiratory infections. The signs of vitamin D deficiency in young children: irritability, deficiencies in growth, fractures of the bones, muscles pain, etc. Diagnosis and treatment. Vitamin D deficiency is diagnosed with a blood test. If your child has a vitamin D deficiency, treatment will likely involve taking a supplement. The recommended dose of vitamin D for children is 600 international units, IU, per day. Your child may need more or less, depending on their age and severity of deficiency. Treatment for vitamin D deficiency in children usually takes 2 to 3 months. In severe cases, children may need to be hospitalized for treatment. Vitamin D deficiency in children is a common problem and can cause serious health problems if left untreated. While getting enough vitamin D from food is the best way to prevent deficiency, supplements may be necessary for some children. If you think your child may be deficient, talk to your doctor about testing and treatment options. If you like the video, don't forget to like, share, and subscribe. Happy parenting!